I'm speaking from outside Frome Hospital in the rain, where we've just finished this month's board meeting. And I just wanted to update you regarding some of the key issues that we discussed during the meeting and some of the actions that were agreed. It was a fairly lengthy agenda this week, mainly because of the importance of discussing the STP, so that's the Sustainability and Transformation Plan for Somerset. This was formally presented to the board, and the board agreed that the Trust should adopt the plan going forward. Whilst we call it a plan, it's actually a strategy, and what we need to do now is develop the detail that will help us to deliver the strategy, and central to that will be engaging colleagues from across the Trust, beginning with the Service and Team Managers Away Day later this month. The board also received a detailed update in relation to the action plan developed in response to the CQC inspection last year. This is a very detailed action plan, as you'd expect, given that the CQC identified a number of areas where the Trust needed to improve. And by and large, progress has been very positive, although there are some areas where further work is required. And this will be a key focus for us all going forward, because we will be inspected again by the CQC early in 2017. Andrew Diani, the Trust's medical director, informed the board that consultant interviews for a number of psychiatry posts will take place on Friday the 25th of November, and it was really encouraging to hear that 5 potential consultants have been shortlisted, so hopefully we'll be able to recruit a number of those to the vacancies that we currently have across our mental health services. Sue Balcom, the Director of Nursing, highlighted that the executive team has now approved a new structure for AHP leadership, which is part of the IP2 programme. Again, this is really encouraging to hear. The lack of AHP leadership has been a real gap for the organisation, and we hope to advertise these new leadership posts before Christmas. The board received a very detailed update from Nick Macklin in his capacity of Director of HR and Organisational Development. One of the things that Nick's report highlighted was that we still have high rates of long-term sickness, particularly on account of colleagues having anxiety, stress and depressive symptoms. It was pleasing to hear, however, that this is less of a problem in Somerset Partnership than it is in any of the other trusts across the South West. Having said that, it's clearly an area where we need to improve our performance, and this is something that we hope the Trust's new health and wellbeing strategy will help us to do. Jane Yandel, who's Head of Division for County-Wide Services, presented a paper regarding improving our community mental health services. This is an improvement plan that has been developed in consultation with colleagues across our mental health services, and the board endorsed this plan. We now need to set up an improvement board to oversee the implementation of the plan, and key to this will be engaging our service users, their carers, and also colleagues from primary care. I, in my capacity as Chief Executive, presented a variety of things in my monthly report. One of these was an update following my visit to the Trust's telehealth service. This is a very small service based at Wellington Community Hospital, and it was really encouraging to see what we can now do in terms of remotely monitoring patients' blood pressure, pulse and temperature. The concern, however, is that the uptake in this technology has been rather limited. We've still got about 250 pieces of kit which are not being used, and going forward it's essential that we use this, and I'm hopeful that the STP and the focus that this has brought on improving our community services will help us to do this. Finally, Pippa Moja, who has responsibility for IMNT, gave an update regarding the Trust's cyber security arrangements. And the reason for this is, as you may be aware, there was a major incident recently at a Trust in Lincolnshire, where there was a cyber security incident that paralysed the Trust for a couple of days. I'm pleased to say that Somerset Partnership has robust plans in place and safeguards in place to ensure that this can't happen, but clearly in the modern world this is something we can't be overly complacent about. That's probably it from me, apart from saying that the board papers are available on the intranet and also via the Trust website. And our next public board meeting will be on the 24th of January, when the board will visit Wincanton Community Hospital for the first time, and hopefully the colleagues will be able to attend that meeting. All the best. Thank you very much.